आगे ना ग्रीन। अब इसको मिनिमाइज कर, मिनिमाइज ये खोल। अच्छा वो बंद कर दिया था ना, अब इसको खोलना पड़ेगा। गूगल ये यूट्यूब कैमरा गो लाइव।
लॉगिन करना पड़ेगा।
नहीं
ये पहले लॉगिन थे तो शायद इससे हो रहा था।
इसको क्लोज करो जैसे था ना पहले। आपका वो काम हो गया जो था। इसको क्लोज ही कर दो। ये भी क्लोज करना पड़ेगा। नहीं स्टॉप करने में यस कर दो। यस नहीं पहले गूगल खोलना था। चलो ठीक है, कोई नहीं, गूगल पे जाना पड़ेगा। कैमरा गो लाइव।
इसमें आपका
ये आप इससे पढ़ा रहे हो क्या आज?
हैं?
जीमेल के इसके थ्रू क्या?
नहीं, आपका ईमेल जीमेल खोलना पड़ेगा। इसमें AIIMS LT वाला जो जीमेल है उसको खोलना पड़ेगा। तो लॉगिन करो ना, इसको लॉगिन करोगे तो हो जाएगा।
लॉगिन क्या करूँगा? मेरे को नहीं मालूम ये सब।
हैं?
मेरे को नहीं मालूम यहाँ कहाँ, क्योंकि ये सब फैसिलिटी के थ्रू है ना, इसलिए तो हमें बोला उन्होंने सीधा बस पेन ड्राइव लगाओ और क्लास कराया करो, और कुछ मत करवाने। उनका शायद आपका लेक्चर उसमें
इसको पूछना है। ये इसको पूछना है।
एक मिनट देखता हूँ मैं इसमें। चलो आप बात इसमें AIIMS का वो डालना है ना।
हाँ, AIIMS LT का, AIIMS LT3 का जो पासवर्ड है वो डालना है।
देखना ये है क्या?
हाँ, ये तो है।
डालो
AIIMS LT2020
अपना स्लाइड
स्टार्ट हो रहा है ना। कहाँ दिख रहा है? चल रहा है करके
लॉगिन, क्योंकि एंड सेमेस्टर है ना,
अच्छा
एग्जाम होने वाले हैं कल परसों से, तो हर साल यही होता है, बच्चे एक हफ्ते से लॉगिन ही नहीं कर रहे इस साल की वजह से। ठीक है, कर लो।
So today class is about drugs for smoking cessation. As you know that smoking, alcohol, drug intake, drug abuse, these are the common conditions or common problems, not only related to drugs, not only related to medical science, but also related to social science. These are problems created by the human beings and affecting the medical science, social science, physical science, everything else in the environment also. So nowadays you know that air pollution is such a factor which is causing so much havoc, and environmental pollution is creating so much climate changes, all these things. So smoking is also related to so many health problems, from acute condition to chronic conditions. So you know that one cigarette contains about 7,000 types of chemicals. It doesn't only contain nicotine, it contains 7,000 types of chemicals. Okay. So let us have a discussion how to stop this smoking. It is easy to start the smoking. Okay. It is very much easier to start smoking habit. It can be started as a occasional activities, or for leisure purpose, or for showing one's smartness, but gradually it becomes a addiction. Okay, you will start with one cigarette once in 10 days, 15 days, as per a social get together, all these things, but gradually it will convert you 10 cigarettes per day to 50 cigarettes per day, or something like that. Okay. So cigarette smoking lead to preventable cause of death in United States and worldwide. It is a leading cause of death. Okay, it is not only just a problem, it is a leading cause of death in worldwide. Okay, tobacco use increases the risk of many acute and chronic diseases, and including cancers and many sides. Lung cancer is the common conditions that has been correlated with smoking, but number of other cancers can also occur, starting from stomach cancer to breast cancers, all these things. It is predicted that smoking will be responsible for approximately 1 billion smoking related deaths during the 21st century. Can you imagine 1 billion deaths? Smokers are, 1 billion means around 100 crores. So near about Indian population. So smokers are 12 to 13 times more likely to die from COPD, chronic obstructive pulmonary disease, than non-smokers. Chemicals in tobacco are mostly the important chemicals has been cited here. Nicotine is there, and apart from that, the toxic chemicals are hydrogen cyanide, carbon monoxide, ammonia, and many more. Okay. So coming to health risks, it can immediately cause acute conditions like your CNS depressions, or respiratory problems, or cough, all these things. Okay, and asthma can be aggravated, all these things. But chronic conditions can be there. It can lead to cancers in these areas. In these areas, it can cause cancer, not only in lungs. It can cause oropharynx, larynx, esophagus, trachea, bronchus, lungs cancers, acute myeloid leukemia, stomach, liver cancer, pancreas, kidney. Every part of the body can be affected. Okay, cancers means every part of the body has been associated with smoking. Okay. Coming to chronic conditions, it can cause stroke, blindness. So it can affect every part of the body. It can cause stroke in brain. It can cause cause means it has been associated. Blindness, cataract, age-related macular degeneration, congenital defects due to maternal smoking, orofacial clefts can be there. Maternal smoking can affect the fetus also. So heart can be affected, coronary artery disease can be there, pneumonia, atherosclerotic things, COPD, tuberculosis, asthma, respiratory defect, diabetes, hip fractures. It can reduce the bone in density also. Reproductive effects can be affected. Ectopic pregnancy can be there. Sexual dysfunction can be there. Rheumatoid arthritis, immune dysfunctions, overall diminished health. So this is not a thing that has been projected. It has been documented by CDC also, Center for Disease Control in USA. So means all these things have significant association with smoking. What happens to the smoke? It goes inside the trachea, and generally distilled nicotine on tar, particulate matter, goes into the lungs. Nicotine absorbed from the lungs goes into the heart, pumped out systematically. So it can affect, what is nicotine addiction? It can affect the CNS and cause addictions. This is due to increase in dopamine, positive reinforcement, and binds to nicotinic type of acetylcholine receptors, and that is mainly affected in the nucleus accumbens areas and ventral tegmental areas. So the nicotine craving cycle is: smoke a cigarette, craving is satisfied, nicotine wears off, then withdrawal symptoms appear, again you have to smoke a cigarette. So this type of cycle comes in. Okay. So strategies for helping smokers to quit are mainly behavioral counseling plus pharmacotherapy. Okay. Initially you can start with behavioral counseling, and if it is not going to operate, then you have to bound to start pharmacotherapy. So for smokers who are willing to quit, it is better to start with behavioral counseling plus pharmacotherapy. And pharmacotherapy for smokers who are considering quitting smoking but are not yet ready to discontinue tobacco use. So one person is dedicated or have decision has been made that he has to quit, then start these things, behavioral counseling and pharmacotherapy. But if the smokers who are considering quitting but not ready to discontinue or completely stop the tobacco use, then you can start pharmacotherapy to reduce nicotine reinforcement, to reduce withdrawal symptoms. Okay. So just like other drugs like morphine or any other things, any drug of abuse, any drug can cause dependence first, then whenever you will withdraw it, there will be withdrawal signs and symptoms. Okay. Similarly, here occurs withdrawal signs and symptoms if you are abstaining from smoking for few days. Okay. So to reduce this withdrawal signs and symptoms and to reduce the nicotine reinforcement effect, you have to start the pharmacotherapy. Let us see. So first line pharmacotherapy are general classes like nicotine replacement therapy. Your nicotine gum, lozenges, patches, nasal spray, inhaler are there. Psychotropic drugs like Bupropion, sustained release formulations are generally used for the smoking cessation treatment. Then partial nicotinic receptor antagonist Varenicline, it is also used for this purpose. So mainly you can say approved therapy are NRT, Bupropion and Varenicline. So NRT, the quitting rate is, if you will start with only behavioral therapy, then quitting rate is only 10 to 12%. Okay. So nicotine replacement therapy, the quitting rate is 19 to 26%. Generally, this treatment are given for a duration of 3 months period, and if there is withdrawal and symptoms is persisting or the craving is persisting, then you can continue it for years together also. Nicotine patch can be repeated for years together. Okay. And along with that, behavioral counseling is common things to be given, but the recurrence rate is very high because the quitting rate is only 19 to 26%, you can see. So rest of the 80% cases just have recurrence of smoking habits. So you can see this effect. So first proven effective medication for tobacco addiction and remains the first line drug. Yes, it is the first line drug, but the thing is that if the patient is having acute effect, acute withdrawal effect, or then you can go for this nicotine replacement therapy. But as far as safety is concerned, Varenicline is the better choice. Okay. It has a chronic, long-term onset of effect. Duration of onset of action is longer, both in Bupropion and Varenicline. Onset of action is late. Okay. If the patient is having withdrawal and symptoms, then Varenicline or Bupropion cannot have their effect immediately. So you have to give nicotine replacement therapy. But the safety aspect is better with Varenicline. Bupropion is having significant side effects. So the current drug of choice, you can say, it is Varenicline for most of the purpose. But if the patient is having acute signs symptoms, then you will go for NRT therapy. So reverse nicotine tobacco withdrawal symptoms and the craving too in the days and weeks following smoking cessation. Okay. So it is the effect of nicotine we have seen. So if you are giving the nicotine supplement, then it will also do the same thing, but we are giving nicotine in a lower concentration. It will just satisfy the withdrawals and symptoms or subside the withdrawals and symptoms, but it will not reinforce the other effect. Nicotine reinforcement will not be there. Okay. So short acting NRT therapy, you have nasal spray, nicotine nasal spray, nicotine lozenges are there, and nicotine gum are there, like chewing gums. So you can see the dose, it is 4 milligram, 105 pieces are there. So 4 milligram dose is given generally. And so nicotine gum, it is commonly used short acting NRT, and chewing the gum releases nicotine which is absorbed through the oral mucosa. This results in peak blood nicotine levels 20 minutes after starting to chew. Dosing is determined by how soon the first cigarette is typically smoked upon awakening. Okay. So the dose is determined based upon a factor that how soon the first cigarette is typically smoked upon awakening. After patient gets awake after the morning, so how fast the patient is going to absorb this first cigarette. Okay. For smokers who smokes within 30 minutes of awakening, then 4 milligram dose is recommended. For smokers who wait for more than 30 minutes after awakening to smoke, then 2 milligram dose is recommended. Chew at least one piece of gum every 1 to 2 hours while awake, and also whenever there is an urge to smoke. So adverse effects are there. It can cause mouth soreness, hiccups, dyspepsia, jaw muscle ache, these things. So coming to nasal spray, delivers an aqueous solution of nicotine to the nasal mucosa. Absorption via nasal mucosa results in peak nicotine levels 10 minutes after the nasal spray use. So dose is 1 or 2 spray per hour, used for about 3 months. The maximum dose is 10 spray per hour, not to exceed 80 total spray per day. Adverse effects are there. It can cause similarly the nasal and throat irritations, rhinitis, sneezing and tearing effect. So these are the short preparations. Coming to long preparations, you have nicotine patches. You can apply the nicotine patches. Okay, you can see in the arm it has been placed. So you can place it in upper chest, upper outer arm, lower abdomen, hip. These are the area preferred for placing this nicotine patches. So this is the use how to place the nicotine patch. This is just like a transdermal patch, and the mechanism of delivery of drug is similar to that of transdermal patch. So smooth, open the protective cover, affix it in the area. Okay. So mean to be removed every 24 hours. It is for 24 hours to be applied. So dose regimen is like this. If the patient is using more than 20 cigarettes per day, then start with 21 milligram per day, week 1 to 4. First week to 4 week you can give 21 milligram per day, then gradually reduce the dose to 14 milligram per day, then 9 to 12 weeks you can give 7 milligram per day. So I have already told you it is a 3-month trial, 3-month treatment durations generally. If the patient is not having this subsidence of withdrawals and symptoms, or craving is not subsided, then you can continue further. Otherwise it is generally 3-month duration of treatment given. If the patient is using less than 20 cigarettes per day, then you can go for 14 milligram per day, then 7 milligram per day, then 7 milligram per day. Okay. So the dose regimen for nicotine patches is there. This is the nicotine patch you have to give. So you can see the effect. Even if you are using these nicotine patches, there can be insomnia, nightmares. Okay, you can have patch allergies. Okay. Where you have put the patch, there can be allergies. These are the side effects. So coming to bupropions, it is generally said that nicotine replacement therapy are contraindicated in chronic coronary artery disease, or in asthma conditions, or in some cancerous conditions. But the actual causal relationship of the nicotine replacement patches with these conditions has not been established. Means you can say that this can be used in these conditions also. But you can say that Varenicline is the better choice of drug in all these conditions. So coming to Bupropion, quitting rate is 24%, somewhat better than nicotine replacement therapy. First non-nicotinic pharmacological agent for smoking cessation. It is atypical antidepressant, sustained release tablet, and safe for use among smokers with stable CVD, coronary vascular disease, and COPD patients. Okay. So coming to mechanism of action, it blocks norepinephrine and dopamine reuptake in the mesolimbic system, and the just like antidepressants, serotonin reuptake inhibitors or TCA tricyclic antidepressants, they act similar way. It blocks norepinephrine and dopamine reuptake in the mesolimbic system. They are 5-HT and noradrenaline reuptake inhibitors, but Bupropion is norepinephrine and dopamine reuptake inhibitors in the mesolimbic system and the nucleus accumbens, and is also an antagonist of nicotinic receptors. So this is nucleus accumbens area, and so it can cause non-competitive nicotine antagonist actions. It can have noradrenergic reuptake inhibitions, serotonin reuptake inhibitions, dopamine reuptake inhibitions. So these are the major functions. Okay. At high concentrations, inhibits the firing of noradrenergic neurons in the locus coeruleus. So basically its function is, you can remember that it blocks the norepinephrine and dopamine reuptake. Okay. In higher concentration, it can have direct non-competitive nicotine antagonist and noradrenergic inhibitions. So coming to pharmacokinetics, the time to achieve the peak plasma concentration is approximately 5 hours and takes 5 to 8 days to attain the speedy plasma concentrations, and absorption is not affected by the food. So high plasma protein binding 84%, so excreted through urine, that is 87%, and feces, that is 10%. So coming to dosing regimen, Bupropion, it is a sustained release preparation is generally used. It started once a week before a smoker's target quit date, since it takes 5 to 7 days to reach the steady state blood levels. So its onset of action takes 5 to 7 days, so you have to start 7 days prior when the smoker is targeting to quit the smoking. Okay. So abruptly quitting smoking appears to be more effective, although gradual smoking reduction, that is 50% smoking reduction by week 4, another 50% reduction by week 8, then quitting by week 12 is an acceptable alternative. So recommend, otherwise there can be precipitation of withdrawals and symptoms. Okay. But that has somewhat been taken care of by the Bupropion's mechanism actions. Recommended dose is 150 mg per day for 3 days, then 150 mg twice daily thereafter. You have to gradually increase the dose. Recommended treatment duration is for 12 weeks, that is 3 months. Okay. So coming to adverse effects, like the NRT therapy, it can cause insomnia, dry mouth, hypersensitivity, anxiety, nicotine seizures. It is the main side effect, seizures. That's why a patients of epilepsy, Bupropion is contraindicated. It can precipitate seizures. It can reduce the seizure threshold. Okay. It is a major side effect, seizures. Okay. And in any other conditions where there is chance of precipitation of seizures, then also Bupropion is contraindicated. Okay. So coming to like head injury or cerebral edema, all these cases you have avoid this Bupropion. So it can also cause agitations, headache. Contraindications are seizures, cranial trauma, hepatic cirrhosis, Patients taking medications that lower the seizure threshold like antipsychotics, antidepressants and theophylline. So these are the adverse effects and contraindications. So coming to the better choice of drug available till date, that is Varenicline. Okay. So quitting rate is about 33%, means the highest quitting rate is with Varenicline. So it is a partial agonist at alpha 4 beta 2 subtype of nicotine type of acetylcholine receptors. So it is a partial agonist. Okay. That's why it subsides the nicotine reinforcement effect. So mechanism of action prevents the fall in dopamine associated with smoking cessation, prevents the fall in dopamine levels associated with smoking cessation, and prevents withdrawal symptoms. Just like Bupropion, it prevents the reuptake of dopamine. What does that mean? It prevents the reuptake of dopamine means it increases the dopamine concentration in the synapse. Reuptake, that is presynaptic nerve ending and postsynaptic nerve ending. So in the presynaptic nerve ending, the neurotransmitter is released from presynaptic nerve ending and acts upon the postsynaptic nerve ending. But some reuptake mechanisms, it can be again taken over by the presynaptic nerve endings. That means it is reducing the concentration of neurotransmitters in the synaptic levels and postsynaptic levels also, where it has to act upon. So if you prevent the reuptake, then the concentration of dopamine or noradrenaline or any neurotransmitters is going to increase. So similar to that of action, Varenicline also prevents the fall in dopamine associated, so it increases the dopamine levels, you can say. But Bupropion, I have already told you, in high dose it can also directly inhibit the norepinephrine actions and nicotinic actions, nicotinic receptor actions. And similarly for Varenicline, it is already a partial agonist on nicotinic acetylcholine receptors and prevents the fall in dopamine action levels. So it acts as a nicotine antagonist and blocks nicotine induced dopaminergic activations. Though it is a partial agonist, but partial agonist will act as an antagonist in presence of a ideal agonist, isn't it? In presence of an ideal agonist, partial agonist will act as an antagonist. Similar thing, so it acts as a nicotine antagonist and blocks the nicotine induced dopaminergic activations, reduces rewards from smoking relapse. So coming to pharmacokinetics, so maximum plasma concentration achieves within time period of 3 to 4 hours after oral administrations. Oral bioavailability is not affected by the food. Low plasma protein binding. Bupropion has very high plasma protein bindings, 87%. Here the plasma protein binding is very less than 20%. So elimination half-life is 24 hours. Undergoes minimal metabolism with 92% excreted unchanged in the urine. And renal elimination of Varenicline is primarily through GFR, glomerular filtration, along with active tubular secretion, possibly by the organic anion cation transporter proceeded to. So you may not remember this thing, but the thing is that it is renally excreted and less plasma protein bound, and onset maximum plasma concentration achieved within 3 to 4 hours. So onset of action is somewhat better than Bupropion, but less than the NRT, nicotine replacement therapy, and it is oral administration can be there. So the dose regimen, the recommended dose for Varenicline is 0.5 mg once daily for 3 days, then 0.5 mg twice daily for 4 days, then 1 mg twice daily for the remainder of the 12-week course. So gradually you have to increase the dose. Okay. The off-titration of Varenicline dose is done to minimize the GI side effects, especially nausea. So main side effects is nausea, insomnia, and risk of cardiovascular disease. So dose reduction is required for those with creatinine clearance less than 30 ml per minute, because it is excreted almost by the kidney. Okay. So nausea is the most common side effects, followed by insomnia. Insomnia, you can say it is common side effects for NRT, Bupropion, and Varenicline. GI side effects are common with this Varenicline, and seizures can be precipitated by Bupropions. Okay. So combination therapy, these are the more effective than single treatment with NRT in dependent smokers. Consider if quitting is not possible with monotherapy. It is considered if the quitting is not possible with monotherapy. So combination can be given as long-acting NRT, that is nicotine patches, plus short-acting NRT, lozenges, gums, okay. Or it can be given as a rapid onset form, that is gum, lozenge, inhaler form, plus slow delivery patches. Combined NRT form plus Bupropion, it can be also given, NRT plus Bupropion can be given. So coming to second line drugs, these drugs have shown some beneficial role, but not used commonly or not been approved for this purpose, smoking cessation purpose. Coming to cytosine is generally used in Eastern Europe countries, but EMEA or European Medicine Agency has not given permission to use this for smoking cessations because its efficacy has not been established till now, okay, though it is commonly used in Eastern European countries. Then other drugs like nortriptyline, it is a tricyclic antidepressant. Mechanism of action, you know it. It is a dopamine and norepinephrine acts upon these systems, like Bupropion. Adverse effects are dry mouth, urinary incontinence, and seizures, etc. And dose is 25 to 100 mg, particularly in depression patients. If the subject is already having depression, then you can give Bupropion in their patients. Bupropion is, and nortriptyline can be given in addition also. Clonidine, it is a central acting alpha-2 agonist, and adverse effects are similarly dry mouth, postural hypotension, drowsiness, etc. So it is preferable in anxiety patients. If the patient is having anxiety, then you can prefer clonidine. Cytosine, it is a partial agonist of nicotinic acetylcholine receptors, just like your Varenicline. Adverse effects are GI disturbance, tachycardia, and nausea. Okay. So coming to some herbal preparations are also used, like Lobeline. It is derived from leaves of Indian tobacco plant Lobelia inflata. It is a partial agonist, just like Varenicline or your cytosine. Not scientifically rigorous trials has been done upon this, so better to avoid these drugs. So this is about smoking cessations, and the thing is that if the patient is willing to quit the smoking, then better to start with behavioral therapy and pharmacotherapy also. If he is not willing, then gradually start the pharmacotherapy, and if the patient is having some acute conditions, acute withdrawal signs and symptoms, then better to go for NRT. And if the patient is only dependent or only having smoking habits, addictions, then better choice in most of the condition is Varenicline. Okay. And you should know about the mechanism of actions, how they act upon, and what is Bupropion and this Varenicline is to be started up-titrated. Start with the low dose and gradually increase the dose. But NRT is to be started with high dose because you are supplementing the same thing. So it has to be started with a high dose, then gradually decrease the nicotine dose. Okay. Treatment duration is generally 3 months. Okay. And but if the patient is not responding or having again withdrawal symptoms, so you can continue these treatments. So this is about smoking cessations, and it is better to have 100% smoking cessations so that it will not affect the chronic disease conditions which are commonly seen nowadays. Okay. So better to stop smoking. Thank you.